In our last video, we looked at ball and socket joints, we looked at the clavicular joints, and then we looked at select ligaments. So, we have the elbow right here. So see, elbow joint, capitulum is right there, that's the radius. Trochleola, that is the ulna. We have two collateral ligaments. We have the radiocollateral ligament going from the lateral epicondyle to the head of the radius, and the ulnar collateral ligament going from the medial epicondyle to the proximal radius. Now, we also have the annular ligament. The annular ligament starts on the anterior ulna, wraps around the head of the radius, and goes to the posterior ulna. This little thing on the radial tuberosity, that's the bicep tendon. Remember, the muscles also are going to help give stability to the joints. This is the shoulder joint. And we talked about how this is a planar joint between the clavicle and the acromion, how on the sternal end we have a saddle joint. You can actually see some of the saddle part. I guess that's the cowboy part. Now we have the glenohumeral ligament right here. So we have the head of the humerus and the glenoid fossa. And see how it's connecting to the lesser turbuckle and a little bit on the greater turbuckle. This right here is one of the bicep tendons, and it's going in the intertrabecular sulcus. Now, the ones that I talked about, we have the coracoid process and the acromial process. So it's called the coracoacromial ligament. This ligament right here, we have the acromion, we have the clavicle. So it is the acromioclavicular ligament. And we have the coracoclavicular ligament right there. So can you tell I just like the coracoid process and the acromial process on these ligaments? Now, there's one ligament that is not on this model, which is very surprising. Actually, that might be it right in there. So we could pretend this ligament is the coracohumeral ligament. That's actually the glenohumeral ligament right there. That's the bicep tendon. So it would really go from about here down to here. So I'm really surprised it's missing on that model. So basically, I like the ligaments because they are named for landmarks we learned last chapter. So your hip is a ball and socket joint. You have the nice socket of the acetabulum, and you have the head of the femur acting as the ball. A bunch of muscles that contribute to the stability. In fact, there's some it does this to the hip. In reality, they're not completely sure because it's such a deep muscle, so I'm going to just be safe and say it's a hip stabilizer. So, there's three main ligaments that we care about. So here's the ilium, here's the greater trochanter, here's the lesser trochanter, here's the ilium here, here is the ischial spine, here's the ischial tuberosity, greater trochanter. So the iliofemoral ligament, you've guessed it, it goes from the ilium, and it is going to go to the greater trochanter, like so. So this is all the iliofemoral ligament right there. The pubofemoral ligament is going to go from the superior pubic ramus to the intertrochanter line. So the line between the two trochanters right there. So that is where that is going. Then the ischiofemoral ligament goes from the ischium right here. And you guessed it, to the greater trochanter. This greater trochanter is a very busy trochanter. Here's the lateral view of the iliac crest right here. Iliac crest. This is the greater trochanter. There's the pubic symphysis right there. The ischial tuberosity is back here. So since I just turned them to the back, let's start with the ischium. Here's the ischial tuberosity. Here is the ischial spine. Here is the beginning of the ligament, and it goes to the greater trochanter. Hi, greater trochanter. My favorite trochanter, by the way. So this is the ischiofemoral ligament. Iliofemoral ligament, this is the anterior inferior spine, so it's a little bit below it, and it is going to go to the greater trochanter. And some of it's actually going to go to the trochanter line right here as well. Now the pubofemoral ligament, what that's going to do is we have the superior pubic ramus, and this is going to go down. And it really does go to the inner trochanter line back there. So that picture wasn't the best picture in the world showing the line. And there's another ligament that actually attaches the head inside the acetabulum. We're not going to worry about that ligament though. So here's the knee. We have the patellar tendon going down. At the patella, it magically becomes the patellar ligament because ligaments attach tendon to bone. Ligaments attach bone to bone, and tendons attach muscle to bone. So there are two collateral ligaments, one on the lateral side, one on the medial side. Now this is lateral. I know that because there is the head of the fibula. Remember, my wife does not let me anywhere near the Halloween skeletons because they're all backwards. So this is the lateral collateral ligament, or fibular collateral ligament. I personally like fibular collateral, but you hear lateral collateral all the time, so I'll accept that. This right here goes from the medial epicondyle to the proximal tibia. So it's the tibial collateral ligament or the medial collateral ligament. That's the one you hear about athletes tearing all the time. So lateral collateral ligament from the lateral epicondyle to the head of the fibula. Medial collateral ligament, medial epicondyle. Now if I open this up, I can see these are extracapsular ligaments. They're outside the capsule. I can see two intracapsular ligaments, and they're forming a cross. This one goes from the anterior tibia, this one from the posterior tibia. So they form a cross inside. And another name for a cross is cruciate. So if I look at the back, we have the posterior cruciate ligament going from the posterior tibia up to the condyle. And we have the anterior cruciate ligament coming right here. We're not going to worry about that guy. Now in the knee, you also have a meniscus. You have a lateral meniscus and a medial meniscus. And this helps the condyles fit in better. Allegedly, you have some movement side to side. So the knee is primarily a hinge joint. It has some rotation due to the meniscus. Remember, meniscus gives you a little bit extra movement. And the patella increases tension on the magical patellar ligament tendon. You can survive without a patella. You're just not going to run a marathon or anything. Now, you have something called the iliotibial band, or IT band. And it actually runs from your hip all the way down, and it attaches to the tibia right there. So, and that stabilizes laterally. So I ran a half marathon, then we walked back to the car, which was another 4.5 miles. My IT band hated my guts after that. It was my first half marathon. So there's two sets of ligaments. The collateral ligaments are extracapsular ligaments, meaning they're outside. This is the lateral collateral or fibular, because it goes from the head of the fibula to the lateral epicondyle. This is the medial collateral. It goes from the medial epicondyle to the medial part of the tibia. So lateral collateral, fibula, and epicondyle, medial collateral, tibial, and epicondyle. The intracapsular ligaments, wrong way, are cruciate ligaments. You have the anterior cruciate ligament going from the front or anterior of the tibia to the back of the femur. Then the posterior is going from the back of the tibia to the posterior part. So they form a cross. This is the one that Klay Thompson hurt. This is the one you hear all the sports stars hurting. How am I going to ask this? Well, where's the annular ligament? Forearm, shoulder, or hip? It's in the forearm. It wraps around the head of the radius. Oops. The acromioclavicular ligament, don't get this one wrong, is in the forearm, no. Shoulder, hip, knee. I hope you said shoulder. The acromions in the shoulder, the clavicles in the shoulder. The intracapsular ligaments in the knee are anterior and posterior, collateral, cruciate, collectible, cephalopod. It has to be cephalopod. World needs more cephalopods. That's squid and octopuses. It is cruciate because they form a cross. And that's why I do not like them the abbreviations, because it is lateral and medial collateral, anterior and posterior cruciate. So we're going to look at some joint conditions. A sprain. here is the talus, right here. There is the medial epicondyle of the tibia. Here's the lateral epicondyle of the fibula. That makes up your ankle bone. You do not break your ankle. To break your ankle, you'd probably break this right here. It would not be pleasant. Instead, what people call a broken ankle is actually a sprain. I'm an expert at getting ankle sprains, by the way. It is twisting intent or stretching that tears ligaments. The bones still are in place. Now you damage a ton of blood vessels, so it gets really, really, really swollen. Fun fact, when you're hiking and you roll your ankle, you do not take your boot off because it keeps the swelling down. No, I've never done that before. The swelling and hemorrhaging is from blood vessels. And yeah, the ankle is most frequently sprained, not broken. Now, bursitis. That, remember the bursa, the fluid-filled sac? Bursitis is inflammation, usually caused by a blow. Tendinitis is an inflammation of tendon sheaths. So you hear sometimes that Clayton Kershaw has tendinitis in his forearm. That means he has a tendon sheath in his forearm. That silly ulnar collateral ligament, and that means Clayton Kershaw would be out for a year and getting Tommy John surgery. By the way, I'm old enough to have seen Tommy John pitch. He went from a very hard throwing lefty to a very crafty lefty because of his tendinitis and his surgery. So, that is the conclusion of our lectures. Thank you.